Hi, I'm Dr. Chad Donnelly, Program Director of the Emergency Medicine Residency Program at St. Elizabeth Boardman Hospital. Thank you for your interest in our program. We understand that choosing the right emergency medicine training program is one of the most important career decisions that you will make. I've been involved in the Mercy Health system since I was a medical student. I returned to the area in 2012 after completing my emergency medicine residency training at The Ohio State University. Our residency program has full ACGME accreditation, and residents completing their residency are eligible for board certification in emergency medicine. Our 3-year program offers 9 categorical emergency medicine positions each year. We provide clinical experiences in 3 distinct teaching facilities: a busy community emergency department, an urban inner-city level 1 trauma center, and a community level 3 trauma center. These departments provide well-rounded training atmospheres that prepare our residents for their future clinical practices.
We have fantastic educational experiences, both clinically and in the didactic setting. Our education days are on Thursdays. We meet from 7:30 to 12:30, and during that time frame, we have a variety of different educational experiences we try to provide for our residents, so it's not very mundane. We don't do death by PowerPoint. We do EKG review, pharmacology review, radiology review. We also spend some time doing cases, and we use the foundations format to do so.
Throughout our emergency medicine months each year, we get to train here at Boardman, which is more of a community hospital, but huge volumes. Our level 1 trauma center downtown we train at as well, large volumes, and then a level 3 trauma center, which is also it's a level 3 but also a community hospital where you see a lot of pediatric patients as well. Just the ability to train at all 3 different places every single year we get experience at each hospital, I think sets us apart, where we're not in the same department every single day all throughout the year. We get different patient populations, we get different attendings, just a broader experience.
Building on that, it's honestly huge, because like you said, you'll be prepared to go anywhere, no matter where you want to work afterwards, whatever situation, whatever kind of setting you want to be in, you'll be ready to go. And you never know what life is going to throw at you in the future. There's curveballs all the time, and if you end up somewhere other than where you thought you were going to be, you'll be able to practice there and you'll be very good at it.
Our program offers a family atmosphere and supportive learning environment. Our residents enjoy graded clinical responsibility and the opportunity to develop their teaching skills by participating in the education of our medical students. Our faculty and staff are outstanding mentors and educators.
The materials that we provide to you are also quite varied. We realize that not everybody learns the same way, and we also know that textbook learning is not for everyone, so we do provide you text, but we also provide you with journal articles, both in electronic format and paper format. We provide you with question banks as well as podcasts, so that all of your needs can be met, and you have a number of ways in which you can see the different materials that are out there for you.
One of the other reasons I chose to come here is the faculty. We have great faculty members, and they attend all of our didactic sessions. They do a lot of on-the-job teaching too, which really helps a lot. Another thing too is we are no shortage of procedures here as well. We get so many procedures in your first year. You have to get a certain number when you graduate, and during your first year, you have all your numbers basically by the time that you finish your intern year. And we always do this saying, so you see one, you do one, and then you teach one. So we kind of try to follow that and pass it down to our other interns, making sure they're getting all the procedures that they need as well. And even with other specialties too. So if we have a reduction that we're doing, for someone that dislocated their shoulder, for example, if orthopedics comes down, that you can say, hey, can I do this, or can you show me this technique? And they're really good about letting you do the procedures on your own.
Hadn't really been to Youngstown until I came here. Cost of living is not expensive at all, and it's very close to a lot of big cities. You got Cleveland is about an hour and 10 away, Pittsburgh's like 50 minutes away, Columbus is like 2.5 hours away, so it's kind of right in between everything. It's easy to get to any of those cities if you want to go have a weekend or a night out, but then you can come back. Youngstown itself, you can get around really easily.
There's a lot to do here too. Like in our spare time, we go to a lot of parks, and there's a lot of golfing and stuff like that to do. I'm a big runner and hiker, so we'll often go to Mill Creek Park. We have great trails and other things to do outside of work, which makes it a nice area to live. And I'm actually from around here, so it's a nice area to raise a family and to grow up.
Someone asked me why I would encourage you to come to our program. I would look back to my own journey in emergency medicine as a good example. I live in Pennsylvania. I drive past 3 hospitals to come here to work. I have stuck with this program. I was one of their residents many years ago. They are my family. The guys that I work with, I grew up in emergency medicine with, and I certainly love being a part of the program because the residents mean a lot to me, and being able to carry on the tradition that I was a part of is very important.
Our faculty leaders are actively practicing hands-on clinicians who work alongside our residents in the emergency department. Bedside clinical expertise coupled with educational backgrounds make our faculty some of the best. Ultimately, our program aims to graduate resilient, well-rounded emergency physicians who are excellent clinicians and lifelong learners. Thank you for your interest in our program, and welcome to Mercy Health.